Video and content disclaimer. I am not a medical practitioner, but I am a nurse by profession and an educator by practice. This vlog reflects my own understanding of the underlying topics. However, this vlog is based on my careful research and my own perspective. You can always verify everything by yourself. You can consult a professional practitioner and obey their instructions given. This presentation does not guarantee to be fully correct and fully precise. Your comment is highly appreciated. Thank you very much.
Hello everyone, welcome to my vlog, and of course today we'll be having a brand new episode, and our episode today is going to focus on the pre-pregnancy preparation. So I'll be sharing with you the 5 tips on how to prepare prior to pregnancy. Okay, but before that, I would like to share with you this premise from Maureen Hawkins. And she said, "Before you were conceived, I wanted you. Before you were born, I loved you. Before you were here an hour, I would die for you. This is the miracle of mother's love." So that is actually going to be a premise from Maureen Hawkins. And of course, I would like to say thank you for allowing me to share with you that specific premise. Pregnancy is an exciting and rewarding experience for any woman. Pre-pregnancy preparation is essential in the journey of pregnancy. Being well prepared would optimize your chance of a smooth pregnancy and a healthy baby. It prepares you both physically and emotionally. Now that you have decided to embark on the journey of motherhood, let us see how you can prepare yourself for a healthy pregnancy. Ideally, you should start at least 3 months before you conceived, but it is never too late either. So now I'll be sharing with you the 5 tips on how to prepare yourselves before you're getting pregnant. The first one is start young. The prime of your fertility is when you are 20 to 24 years old, with a sharp decline from 35 years old onwards. On average, there is a drop of 3% in fertility with each increasing year of the woman's age. The chance of genetic abnormalities like Down syndrome, as well as complications in pregnancy like miscarriages, high blood pressures, and diabetes, increase as you grow older, particularly beyond 35 years of age. So start when you are in your prime. The second tip is pre-pregnancy supplementation. It is important to take a diet balance in calories, carbohydrates, proteins, and fibers. Folic acid is a type of vitamin B that is needed for the formation of blood cells and the development of baby's nervous system. It has been shown to reduce the chance of having neural tube defects, or also known as a spinal cord and brain abnormalities. A simple way is to take a folic acid supplement of 5 mg at least 3 months before conception and continue for the first 12 weeks of pregnancy. The third tip is preconception checkup. Visit a gynecologist to discuss your chance of conception, previous medical problems that may affect your pregnancy, family history of genetic problems, and immunization history. Your checkup may include a pap smear test, thalassemia or your genetic blood disorder test, and rubella or your German measles screening. A pelvic ultrasound scan can also be performed to check for ovarian cysts or fibroids in the womb. The fourth tip is optimize your medical conditions. Controlling your medical conditions such as diabetes mellitus and hypertension improves the prognosis for you and your baby. Consult your obstetrician early, as pregnancy could be complicated with such medical conditions. If the medical conditions are well controlled before you conceive, you are more likely to have a smooth pregnancy and a healthy baby. Other existing medical conditions that could affect or be affected by pregnancy include: we have your autoimmune diseases such as systemic lupus erythematosus and rheumatoid arthritis. Second one is epilepsy. Third one is thyroid disorders. We also have asthma. We also have anemia such as iron deficiency anemia or thalassemia, including kidney disease. We also have heart disease. Included is your deep vein thrombosis or pulmonary embolism, and that includes your blood clots in the legs or lungs, and also with depression. It is possible to have a successful pregnancy if you have one of these chronic conditions, but it may be considered a high-risk pregnancy, and you will have to take some special precautions. If you are on a chronic medication for these conditions, your gynecologist will want to assess them in terms of their effect on you and your developing baby. For example, if you are non-diabetic on oral medication, you will need to change to insulin injections once your pregnancy is confirmed. Last tips for pre-pregnancy preparation is avoid high-risk activities. It is advisable to stop smoking. Substance abuse and smoking are associated with miscarriages, slowing of baby's growth in the womb, premature delivery, and bleeding in the placenta. Avoid excessive alcohol and binge eating. This can lead to congenital malformations and also mental impairment of your baby. Okay, so those are the 5 tips in order for you to have your pre-preparation before you're going to have your pregnancy. Again, the first one is start young, the second one is pre-pregnancy supplementation, the third one is preconception checkup, the fourth one is optimize your medical conditions, and the fifth one is avoid high-risk pregnancy. Let us now have the most common frequently asked questions by mothers. And this question is, what are some problems that older mothers may face during pregnancy? It is important to reiterate that most pregnancies in older mothers have a good outcome. Traditionally, an older mother is defined as any expectant mother who is 35 years old or more at her expected date of delivery. There is an increased incidence of chromosomal problems as the quality of the egg may deteriorate with advancing maternal age. In particular, there is an increased risk of Down syndrome when compared to a younger age group. There is also an increased risk of twin pregnancy. In addition, older mothers have an increased risk of miscarriages. Overall, there is an increased tendency to medical conditions such as pregnancy-induced hypertension and gestational diabetes. It is important for any mother with an advanced maternal age to see an obstetrician early so that proper follow-up and test can be performed. So of course, there is going to be an increasing tendency that an older mother may have, especially when they get pregnant at a later age. So these are the pre-pregnancy preparation that I'm actually telling you guys, especially when you want to get pregnant, because of course, it is very important for you to have a planned pregnancy. And of course, pre-pregnancy preparation is very essential because this will actually give you an opportunity to have a healthy pregnancy and at the same time a healthy baby. Again, your pregnancy preparation tips includes start young, second is pre-pregnancy supplementation, third is preconception checkup, fourth is optimize your medical conditions, the fifth one is avoid high-risk pregnancy. So these are the tips prior to pregnancy. If you're new to this channel, please don't forget to subscribe, click the notification bell, and at the same time, like and share this video for those of you who wants also to share this information to others, especially if they want to get pregnant also in the future. This has been Nurse Jose at your service to make your best even better.